Thank you all for being with us this evening. We're very pleased to have with us this evening Representative Greta Neubauer from the 66th Assembly District, which covers most of the city of Racine. As Michelle mentioned, this is the first in a series of conversations we plan to have with our state legislative delegation, beginning with Representative Neubauer this evening, followed by Representative Whitkey next week. And then we're also planning to invite the other members of the legislative delegation from Racine County throughout the year, as well as some of our county officials. So look for this to be a regular feature throughout 2021. One more announcement, effective Saturday, we'll be entering Mental Health Awareness Month, which is in May. And we have a number of different educational programs occurring throughout the month. So I'd urge you to learn more about those and attend whichever events are relevant to you. So our basic format, we're going to ask Representative Neubauer just to introduce herself, not that she necessarily needs an introduction, but to give us a sense of her legislative district, her role in the legislature currently, any particular interests she has in mental health issues. And then we'll transition into some specific questions, most of which relate to the state budget, which of course we're in a budget session, which Representative Neubauer will describe. So Representative Neubauer, over to you.
Great. So very happy to be here with you all. Thank you for taking the time. And I, as Pat and Michelle said, represent most of the city of Racine. I've been in office now for about 3 years. I was born and raised in Racine and really love representing our community in the legislature. I serve right now on the Joint Finance Committee, which is our state's budget writing committee. We started our work in January and are deep in the budget process. I literally think I had 10 meetings today and they all were about the state budget. So we are digging into the policy. We are continuing to take public comment right now, and we're preparing to start voting on the budget probably next week. If you followed along, you know that the way this process works is the governor introduced his budget at the beginning of the year. It then came to us in the finance committee. We started public hearings a couple weeks ago, traveled around the state. We have a virtual hearing tomorrow. That is our final public hearing. And if you are lucky, you were able to sign up and get one of those coveted spots at the virtual hearing. But it actually filled up in 19 minutes, which really indicates the interest in participating in that hearing. Unfortunately, despite some of us calling for an additional public hearing that would be virtual, the co-chairs of the committee have decided not to do that. I'm happy to share a little bit more about how folks can engage in the process going forward and answer any specific questions. But the main formal way that you all have right now is to submit public comment online. And then, of course, do events like this and reach out directly to your legislators and other members of the Finance Committee. So as I said, we're going to start voting next week, likely on Thursday. Will be our first day of voting on the budget. And that will continue probably at least for a month and a half, could be much longer if we don't reach agreement. And we will see how the budget process goes this year. But it'll be in the Finance Committee for a while before going to the full legislature for a vote, and then of course to the governor, who is able to sign, veto, or partially veto the budget. So it's a really interesting process. We have gotten comment from thousands of people and many people who really highlighted mental health issues. That has especially come out in hearing from young people, from students, from teachers, right, about their experience both working with young people and their own experience trying to teach from home. That was really highlighted by the Department of Public Instruction. In their visit to the committee, they talked about the significant needs that our students face and the proposals in the governor's budget to address mental health in schools. We didn't have the Department of Health Services come in front of us, but of course the budget includes a lot of important items for mental health, which we will get into in a little bit. And I guess the last thing I'll say by way of introduction on this topic is just that it's really clear to me from the conversations that I have both through my work and through my personal life how significant the mental health impacts of the pandemic have been on our community. We all know probably many people who have been struggling, frankly, through the pandemic. And for those who were struggling before the pandemic, it's even worse, right? And we are sort of seeing the light at the end of the tunnel with vaccines available and many of us getting vaccinated. But I frankly think we are not through the woods in terms of the mental health impacts of this pandemic. And I think we're going to continue to feel those for quite some time, which is why these investments in this budget are so critical. So just really happy to be here with you all. Thank you for this forum and all of your advocacy, and excited to get into some policy.
Very good. Well, thank you very much. We'll start with one of the most visible issues and one that can have a tremendous impact on available resources to fund mental health services, which is Medicaid. And specifically, want to have an understanding of your position relative to accepting the federal expansion of Medicaid. As you know, there are approximately 38 states that have done so and approximately 12 that have not. And then if you could talk about the implications of either accepting the expansion or rejecting it from your perspective. And then what you think the prospects are in the legislature of moving toward accepting Medicaid funds in this session.
Yeah. So thank you for asking this question and just highlighting the importance of this issue. It is something I feel really strongly about. Since I've been in office, I have advocated for the Medicaid or Badger Care expansion in the state, including traveling around to a number of communities and trying to spread the good word about what expanding Badger Care in our state would bring. So some of you may be familiar, but for those who aren't, Badger Care provides healthcare coverage for over 1 million Wisconsinites right now. And expanding Badger Care would extend that reliable, affordable coverage to folks who lack access. And that includes access to mental health services and treatment. The Badger Care expansion increases eligibility. So it takes us from 100 to 138% of the federal poverty level, which is a wonky way of saying that it covers people who are struggling to get by. 138% of the federal poverty level is $17,700 a year for a single adult. 100%, which is what we cover up to now, is $12,800 a year for a single adult. So if you can imagine trying to afford healthcare with that yearly income, you know how important this is, and frankly how painful it is that we have not accepted Badger Care, the expansion up to this point. So again, the population that we're sort of focused on here with the expansion is childless adults, and it increases the availability. It would cover, it is estimated, probably about 90,000 more people with Badger Care if we accepted the expansion. And what the federal government gives us in exchange for covering more people is that they pay a larger share of our costs. It decreased the state's share of covering everybody who is on Medicaid. And that benefit was increased with the American Rescue Plan, which was just passed by the federal government. And so they will pay 90% of costs instead of 60% for our Medicaid costs, which would save Wisconsin $635 million over the next 2 years. And in addition to that, this additional benefit from the American Rescue Plan is that we would receive a one-time $1 billion increase in federal payments if we were to accept the expansion right now. So if you're adding those things up, that's $1.65 billion over the next 2 years that we could be adding to our revenue, and therefore spending on a lot of really important items that we will get into. But just to summarize, right, what we're talking about is we're talking about covering more people. We are talking about having more revenue that we can spend on other programs. And what it does for the general market is that it helps stabilize the market, because it further decreases the number of people who are not covered, which means that in states that have expanded Badger Care, we particularly looked at Minnesota, it has decreased rates on the private market for everyone. So it does increase access and affordability for everyone, even those who are not covered by Badger Care. So this is a really important item. It is something that I continue to think is a top priority, perhaps the most important issue in this budget, just because it is so clear the need for access to quality, affordable care, and it doesn't cost us anything as a state, right? It in fact brings money into the state to do the right thing. In terms of the prospects, Speaker Robin Vos has said that he is not interested in expanding Medicaid. And frankly, he has a lot of power in the legislature. And so it will be hard for this to move forward without his support. A number of members on the right side of the aisle have indicated that they have some interest, have indicated that they understand the importance. But frankly, I think without Speaker Vos and the leadership in the Senate moving, it's going to be hard for us to get this passed. So to all of you who are community members in the Racine area, I really encourage you to reach out to him to make sure that he understands that this is one of your priorities and how it would impact people's mental health in our community.
Very good, thank you. Can you comment on Medicaid match, especially Medicaid match levels for outpatient and other community-based services? Mm-hmm. We've had some information shared that Wisconsin is at lower levels than surrounding states. And is it possible to address that issue without accepting the federal expansion? Is that inextricably linked with the federal expansion?
So we could, of course, move forward on a number of these policies, but we don't have the money to do all of them if we don't take the expansion. So I think what is very likely to happen is that the Medicaid expansion will be removed by the committee, and then as we go through the process, the Republican leadership will say, sorry, we just don't have the money for a number of these programs. To which, of course, we will say we would have the money if we accepted Medicaid. I think to get the level of increases for a number of these programs that we want and that Wisconsinites need, we do need to accept the expansion because, of course, Wisconsin has to balance its budget. We don't operate like the federal government. We can't go into debt in the same way. So we do need to have that revenue coming in to be able to spend it. On this issue, the budget provides $2 million for this program, the program that would allow non-county providers to bill Medicaid for psychosocial rehabilitation. Psychosocial rehabilitation provides a wide range of treatments and services for Medicaid members who need more support than is usually provided in an outpatient setting. So expanding this benefit beyond counties improves the continuum of care for mental health, substance use disorders for those communities that may not have the services right now, and reduce the need for those crisis services. And we expect, improve outcomes long term. So that is a really important piece and something that, frankly, we've been hearing about around the state.
Thank you. So another topic you may have been hearing about is growing the mental health workforce. And of course, there's much conversation about concerns about shortages in other aspects of the healthcare workforce as well. But one of NAMI Wisconsin's top priorities is to grow the mental health workforce for the future, to respond to not only the needs from the current COVID-19 situation, but overall increasing need and demand for various types of mental health services. So wondering if you can comment on your philosophy and thoughts on the most effective ways for us to grow our mental health workforce in Wisconsin.
Yeah. I think I guess the first thing that I'll say is that what we need to be doing is we need to be supporting people to go to school or go back to school and to not take on overwhelming amounts of debt, right? This budget makes really significant investments in the UW system, in the technical college system. It increases funding for the technical colleges by 17%, and makes, frankly, historic investments in the UW system as well. And then that goes right down to K-12 and early childhood too. We've got a lot of great stuff on education in the budget that I'd be happy to talk more about or answer any questions. But the bottom line, right, is that people need to be able to enter these professions without taking on overwhelming debt. There are some important student loan debt programs in the budget as well, scholarships, particularly those focused on low-income students, underrepresented groups, who, of course, we really need in the mental health workforce as well. And then we need to be talking about how we can specifically incentivize people to enter and stay in this workforce. Wisconsin has attempted a couple of different models, particularly supporting healthcare professionals to be in rural areas where there may not be great access to dental care or other specialists. And so I think we need to continue looking into those options as well for our mental health workforce, again, particularly in those parts of the state where we're really short on providers. But as we all know, everywhere in the state could use more providers. So we've got work to do there. And I do think we have to get at some of those systemic issues around the education questions so that people feel that it's a viable option for them to enter that workforce.
What about alternative approaches like telehealth, telepsychiatry, some of those new approaches to delivering certain types of services? Is there anything the legislature can do to incentivize those types of approaches?
Yes, absolutely. So, of course, the pandemic has really highlighted the importance of telehealth. Luckily, Wisconsin was sort of moving down this path due to some legislative action over the last couple of years. But, the pandemic absolutely has highlighted that this is an essential service. So a couple pieces, right? One, this budget makes really significant investments in broadband internet, over 150 million through the Public Service Commission to increase access to broadband, which is an essential component of telehealth. We know that every community has trouble, different sorts of troubles accessing the internet. We know there are some communities in which there are no providers, right, for high-speed internet, for broadband. And then there are some communities like Racine, in which the infrastructure is there, but people may not have the money to pay for it. So both of those issues are important for us to address with this budget and going forward. And then the budget, makes continued investment and coverage for telehealth, and makes, again, that really significant investment of broadband money, and also attempts to ensure that people with private insurance have access to telehealth services. So what we're talking about is a telehealth parity law, right? Making sure that no matter who covers you, that you will have access to those services and that they will not be considered out of network or cost much more than actually showing up and visiting a provider in person. So really hoping that we can see some progress on that. One of the things that's getting a little bit into the weeds about how this budget process works is that Republican leadership has decided that they do not want to include in the budget items that are considered policy items. So these would be things that they say that that's more about policy and less about the fiscal impact on the budget. And so unfortunately, I think we're going to see the removal of a number of items that are considered policy items from this budget. And I've heard that that might include some of the telehealth policy. That does not mean that you shouldn't keep I guess I'll remove my double negative. You should keep advocating for those policies. And I do think that, you know, I guess I'll say I'm hopeful that members on both sides of the aisle understand the importance of that, that parity, and that we'll continue to discuss that throughout the legislative session.
So in theory, those would then be standalone items considered separate from the budget process, even if they have budgetary implications, or?
Yes, that's right. So this is not, again, the way that it needs to work, but it's sort of the decision that the co-chairs have made about how they want the budget process to work. And that is that they've asked our Legislative Fiscal Bureau to pull out, to isolate all of the items that are policy, not fiscal. And then what we anticipate, unfortunately, is that a lot of those items are going to be removed right away from the budget process, meaning that we don't really get a chance to debate them, nor can we reintroduce them to sort of to bring them back into the budget discussion. So once they're taken out, we're not able to propose an amendment to put them back in, basically.
What is your view on incentivizing certified peer specialists and other peer-run programs as a method of growing our mental health workforce and providing valuable services going forward?
Yeah, I think this is really important. I was able to engage a little bit with some of the task forces we've had over the last few years in the legislature. Suicide Prevention Task Force, you know, focuses on mental health. And what we really heard, particularly from young people, actually, was the importance of these peer support opportunities, avenues. So, you know, staff at these peer support run respite centers, run the warm line, right? However, with the increased calls that we've seen, particularly because of COVID, they often had to choose between answering the phone and helping residents at these centers. So the budget proposes at least 2 new positions at each of these respite centers, so staff can better serve residents and support callers in non-emergency situations and refer emergencies to local crisis centers. Certainly supportive of that provision. And then again, you know, this number of calls has really increased in recent years while employee turnover and shortages have really worsened. So it is really important for us to make sure that we're providing this funding and this staffing because particularly of those workforce issues that have been exacerbated. So we really need to make sure that these lines are staffed and that we're doing what we can to support, again, young people and the peer-to-peer support that we know is helping them in crisis context as well.
Very good, thank you. Shifting gears a little bit, one of the national NAMI's priorities was the successful adoption at the federal level of the new 988 National Mental Health Emergency Hotline, which is scheduled to become active in 2022. But it seems as though it'll be crucial that the state have a plan to take full advantage of the new 988 hotline dedicated to mental health emergencies and suicide prevention. What are your thoughts on how we should develop a plan and make certain we have a fully coordinated, comprehensive response to the new 988 system?
Yeah, great question. So for folks who don't have context on this, right, everyone's encouraged to dial this 10-digit numbers as part of the new 988 system. This change is being made as part of the effort to establish 988 as a new nationwide crisis hotline number. This is something that our Senator Tammy Baldwin worked on, and would be used to connect people to suicide prevention, mental health crisis counselors. And as Pat mentioned, it's slated to launch in 2022. So I don't know about all the specifics, sort of how this is going to be implemented, but I do know that there, has been a lot of conversation at DHS and a lot of focus on making sure that we do have resources available for those who need it, and particularly recognizing that many people are not close to providers. We need to make sure that these lines are available and that people are able to access them in the moment that they need them. So it's, I think, ongoing conversations about how this is integrated, but just really pleased to see this effort from the federal government. Of course, really helpful to us to have a national crisis hotline number that then, will allow us just to do some better triage. But it doesn't replace the need, right, for all of these local resources that we're talking about as well, for people to have that longer term care and support.
Speaking of some of those types of resources, I know one of the proposals in the governor's budget is to establish additional regional crisis stabilization services and centers.
Mm-hmm.
What is your view on that proposal? And what do you think the prospects are for the state legislature to support that initiative?
Yeah. This is an issue that I do think is bipartisan. I have heard about it from folks all over the state. As I mentioned, we were traveling last week. We were in Rhinelander, Menominee, UW-Whitewater the week before. And we do hear from people in every community, and particularly rural communities, right, about the long drives that patients often need to make, or that law enforcement needs to make with potential patients. And just the fact that there are literally not enough beds, right, for the needs that we have. So we're looking at a $12.4 million investment in this governor's proposal, which would establish up to 2 regional crisis centers that can provide inpatient services and 5 crisis stabilization facilities around the state. It also increases in-state support to counties and municipalities for local mental health treatment and responses. And I actually have talked with our local human services, our county human services, about this item, and confirmed with the Department of Health Services that this would provide additional resources for communities like Racine, if they were to apply, to increase our number of beds in our local programs. So we're not just talking about the new programs, but we're also talking about increased support to the programs we already have, like the one run in Racine. And then finally, this provides funding to support a behavioral health bed tracker to provide real-time inpatient peer respite and crisis stabilization capacity. So it reduces some of those logistical challenges that we're having right now. Again, often law enforcement having patients in the back of their car and driving long distances, and frankly not being sure if the folks are even going to be accepted into the facilities, et cetera. So a lot of work to do there. We all know that what we're doing right now is not working. And could pivot a little bit here and also talk about the treatment alternative and diversion funding that attempts to keep folks, right, from engaging or falling into the criminal justice system due to mental health crises or addiction challenges. Happy to talk more about that too if folks have questions. But there are many different angles, I would say, that the governor's budget takes to reduce the number of folks who get into crisis, to reduce the number of people who are then incarcerated, and to make sure that for those who do need those inpatient facilities, that there's a bed for them available.
Since you touched on the intersection between law enforcement and mental health issues, crises, I wonder if you could talk more about your view on the role of diversion programming, as well as steps that can be taken to expand the kind of co-responder mobile model in communities, so that law enforcement personnel can focus on law enforcement issues and other professionals can focus on mental health or other issues in various circumstances. Can you kind of comment on both those different areas?
Yeah, thanks so much for that question. So first, on treatment alternatives and diversion. So this is an item in the Department of Justice budget. We're looking at $15 million per year, which is a significant investment in this program. And I will tell you that over the course of the public hearings that we've had and meetings with constituents, this is one of the items that has come up the most. Because many people who were directly impacted by the criminal justice system, incarcerated, had family members or friends incarcerated, have stories about the needs that they or their family or friends had in terms of mental health services, in terms of addiction or treatment services that went unmet. And then they got caught up in the criminal justice system, and of course that's a connection, let's say, that is hard to break. It continues for many years and really impacts people's lives, ability to find housing, find jobs, etc. So this is really, really important. And again, it is something that we hear about over and over from folks in Racine and throughout the state. So I am really hoping that we can keep this item in the budget. And then on the co-responder model, so the budget includes funding to create a forensic assertive community treatment program, which is meant to bridge behavioral health and criminal justice systems. And it's really intended for individuals with serious mental health illness who are involved with the criminal justice system, designed to improve mental health outcomes, reduce recidivism, divert individuals from the justice system. And there is Milwaukee specific money. Milwaukee has done some really good work over the last several years, recognizing some of these links and doing what they can to reduce incarceration. So Milwaukee County Department of Health and Human Services, really trying to shift towards a behavioral health system, trying to shift their behavioral health system towards a community-based services model. So there's $2.6 million to increase funding, expand resources, make it possible to better respond to crises without involving law enforcement. Their mobile crisis team is made up of clinicians and nurses who respond and assess crises, link people to services, and follow up to offer further support. So this is something, of course, that a lot of people have been talking about over the last particularly year. We discussed a mental health crisis responder unit in the Racine Police Reform Task Force. This is a recommendation that I put forward that a number of folks were focused on, really interested in. It's not something Racine has the funding to do right now, but it's something that we really want to see happen. We know that there are good outcomes for these models and for increasing the availability and access to mental health professionals when people are in crisis, as opposed to law enforcement. So glad to see that we're sort of investing in this specific model, or that the governor's proposal would expand that. And then hopefully we can continue to gather data and show that those outcomes are positive ones that are saving the state money in the long term as well, and then apply that to more communities.
One of the areas NAMI's been involved in for a number of years is crisis intervention training.
Mhm.
And I don't know if there are any additional incentives or initiatives in the state budget to expand CIT training throughout the state.
Um, so, hmm. I'm not sure. That's a great question. I'm not, yeah, I guess I don't have a specific answer on that right now. Obviously a lot of stuff in this budget, but yeah, really
Within the
appreciate,
budget?
really appreciate what NAMI has done. I know that you all have, engaged, supported this crisis intervention training in many communities in Wisconsin, and absolutely important for us to continue to get access for law enforcement.
Absolutely. One other major topic to cover with you, then we'll open it to other questions, and that really relates to children and youth, mental health and education. Um, and you mentioned that there are a number of provisions in the budget, targeted toward these groups. And I wonder if you can elaborate on that, talk specifically about expanding mental health services in schools, as well as what we might call mental health education and awareness in schools, because obviously educating young people about the realities of mental illness and reducing stigma are critical to people seeking care when it's needed and treatment. So
Yeah, absolutely. Yeah, so there are a lot of things in this budget to support mental health for students. And I do really think, again, that this is responding to the reality of this moment. I said earlier that we all know people who have struggled with their mental health in this pandemic. And I think we all know young people probably who have been struggling. And we worry about them. I worry quite a bit. And all we can do is provide the resources that we know students need. And so that is really what I'm hoping we can do through this budget. So a couple of the items that I want to highlight include increased categorical aid for mental health services. So this expands just the aid for mental health services to all districts and increases funding by nearly $50 million to support student wellness. And that's over the course of the 2-year biennium. Sort of within that, it's expanding services so that, and the reimbursement for those services for school districts. As those who have dug into school finance know, a lot of how funding works for school districts is that they are eligible for a certain percentage to be reimbursed by state government. So we're talking about increasing reimbursement for mental health services. We are talking about increasing pupil support staff so that all school districts, and sort of restructuring program eligibility there, so that all school districts, independent charters, private parental choice schools have access to those counselors, social workers, psychologists, etc. And we are also talking about expanding the number of eligible school districts. This is just to highlight this point again, from currently right now, increasing this funding could expand the number of school districts from 87 who are currently eligible to more than 420 school districts, which is really great. That's obviously a huge increase. Couple more items, school-based mental health collaboration grants. The budget provides for an increase of 3.5 million GPR in each year. So we can increase the number and size of school-based mental health collaboration grants. This means that districts can work with partners to better provide services, funding for mental health training for school professionals. As Pat mentioned, we need our school professionals to be able to understand kids' needs, to reduce stigma, to help kids access the resources that they need. And so we've got 500,000 in each year to do that. And then 2 more things I'll highlight: mental health collaboration aid. Again, this is working with community health agencies, partners to get more support into schools. budget increases the funding for those efforts by $7 million over the biennium. And then finally, one point that is related, I guess, that I just want to make is that the budget, it makes really significant investments in K-12. Governor Tony Evers comes from the world of teaching and school administration, and he's really personally seen the impacts that lower reimbursement rates from the state, lower commitments have had on school districts and our ability to meet kids' needs. So one of the significant things that this budget does is it increases special ed reimbursement for all districts. Districts are mandated, as they should be, to fully fund special education. What that means is that often money is taken from other kids, right, from the general pool that we need there to fund increased special education costs, because the state doesn't reimburse those costs at a fair rate. So we're talking about increasing special ed reimbursement to 50% by the end of the biennium, up from less than 30% right now. So this would give schools really significant additional resources. We're also talking about restoring our commitment to 2/3 funding, increasing general aids. So really excited about those investments, and all of those mean not only that kids are generally, being invested in, but also that we have more resources for districts to be able to allocate to their mental health programs.
Very good. Thank you. I don't see any questions in the chat, but am I missing anything there, Michelle?
I'm not seeing any either, no, but we can certainly open it up.
Open the floor to some questions.
Yeah, to free discussion right now. If anyone's got any questions, please feel free.
Yeah, or if anyone has thoughts they want to share, if you're someone who tried to sign up to testify but wasn't able or anything like that, I'm always happy to hear about the impacts that that these budget items have or would have on all of you, or just any other advocacy that you'd like to share.
I guess one question I have is, does the Joint Finance Committee really start with the governor's proposed budget as the baseline and then adjust from there, or is it in fact a totally different budget? I've heard different comments from different perspectives on that. So what's your perspective in terms of how that process will work?
Yeah, so we expect that the process will be similar to how it was last year, our last cycle, 2 years ago, which means that probably in one of the first days of voting, again, the items that are considered policy items will be removed. And then a number of other things that Republicans want to take out. So that could be between 100 and 200 items that are currently in the budget, which would make the budget look more like what we call the base budget. So the budget that we're currently operating on. So we don't, we will be working off of the governor's budget, but I guess to answer your question, yeah, it does sort of look more like the base budget, basically for the bulk of the discussions. And you'll sort of hear people talk about, if you tune into the sessions, which will be long, and I don't know that I would recommend listening to all of them, but you'll hear sort of a discussion of are we working off of base, which is the existing budget, or the governor's proposal, right? Or another proposal that comes forward. So it's my first time on the finance committee, so I'm learning all these things in the process, but that's my expectation of how this is going to go.
And so Wisconsin has a 2-year budget. Are there any opportunities to adjust expenditure levels in the interim, or is that pretty much locked in if that budget's approved for 2 years? How does that work?
Yeah, we can. You can pass legislation to approve additional expenditures. It just has to go kind of through the additional process, and items with fiscal impacts go through finance. So there's a little bit of an extra hurdle there. But yes, absolutely. If something is not included in the budget and it's something that is really important to NAMI or to any of you as individuals, you absolutely can keep advocating for it and hope that and yeah, just keep pushing for some progress there. So would not give up on any items. We can always approve the Badger Care expansion, for example. There is no time limit on that. So yeah, we'll spend the bulk of our revenue in the budget, but there will be some revenue that is left for us to make further allocations throughout the cycle.
Thank you. Other questions from I think we've got one coming in now.
Mm-hmm. So.
So I've heard quite a bit about adult mental health. We had a nugget come in. Great, we love that. So any policies to fund children's mental health, including recidivism in families? The main thing is the Treatment Alternatives and Diversion Program. I'm happy to send you some more information, Maggie, if you have any questions about that. But that is really targeted at making sure that we are not getting individuals who are in mental health crisis or struggling with substance abuse issues caught up in the criminal justice system. On the youth end, there are a number of important juvenile justice policy changes, proposals in this budget. One that has really risen to the top in terms of importance is what's called raising the age, right? So making sure that we don't have youth, 17-year-olds in the adult system, but instead returning them to the youth system, where they are able to access age-appropriate resources, where they're among their peers, where they're in facilities that, of course, are really focused on rehabilitation and education. So that's something that is in the governor's proposed budget. We're hoping to see that move forward. There have, over the last couple of years, been a number of proposals, right, to close Lincoln Hills, the long time troubled youth facility, and move to more rehabilitative facilities for young people. For various reasons, those proposals have not moved forward. Of course, there's been some discussion about this in Racine as well, but that sort of stuck at the state level because of some funding issues, but definitely hoping that we can see a move for youth, but of course for all people towards justice system that is much more focused on rehabilitation and getting access to the services that folks need. So yeah, thanks for that question.
Very good. Other questions?
Thanks. So I guess my
Thank you.
Oh, I'm sorry, Maggie, did you have a follow-up on that?
No, I just wanted to say thank you. Sorry, my service was just slow.
Okay.
No problem.
I think Michelle might have a question.
Yeah, I just had a comment. So I'm currently a junior in college, so it's not like it's been too long since I've been out of the K through 12 system. And I was gonna say I really appreciate the progressive work that you're doing, Greta, because going through that system, even not so long ago, I felt like when it came to mental health services and support and advocacy and whatnot, there was seldom many resources available here, in Racine alone. And to me, it makes me think about the values we have as a country, really, to think that even the youth would not be able to have the resources that they would need to have a proper upbringing, really. So I was just gonna comment on how I appreciate that. So thank you.
Yeah, no, thank you so much. And it's, yeah, just always really helpful to hear from folks too who have direct experience, right? And who went through the schools and who saw the impacts of not having this funding. I mean, right now we have one nurse for thousands of students, right? And that's not even getting into mental health, right? So we have a lot of work to do to catch up. And this is a really good step. These will be really important programs if they are funded and stay in the budget. But yeah, thank you for that.
Mhm.
Thank you. Other
Great.
questions?
So I think, moving forward, across political persuasions or no political affiliation for any of our NAMI members or participants or people who might be interested. I mean, advocacy is one of our pillars, and we take that from advocacy of self all the way to advocacy for mental health policies. So in a way that we can communicate with our NAMI family and our participants in, lay language, what more can NAMI do to get the word out?
Yeah.
And encourage people to be advocates and to let them know about the initiatives out there.
Yeah. Well, I know I've said this to you all before, but I will say that you're doing a really great job. I know you do forums during the election season, right, to highlight candidates' positions on the issues, and frankly, there aren't that many of those. You'd be surprised, right? How few kind of forums there are and opportunities for us to debate these issues during the campaign season. So really appreciate that work that you all do. Just so important to provide information to voters, right? About the commitments that everyone's going to make. And then, I've done a couple of events with you all, but I know that doing these kind of events and having legislators on and getting specific about the policies is really great. And, equipping your members with all of the detailed information they need to really be effective advocates. I would say in terms of going forward, it is really hard with everything being virtual. And I know you all are doing your best. As I said, the last sort of public hearing, virtual hearing on the budget is full. But what I really encourage folks to do is just to reach out directly to legislators. Of course, your own legislators, whether that's me or Senator Wirch or whoever else in our area. But also you can reach out to other area legislators or to members of the Finance Committee. I get a lot of mail right now, emails, calls from folks around the state on the budget. And we look at those, right? We do look at those and we say, okay, we got a lot of contacts, on K-12 or on childcare or on Badger Care, whatever it is. And so I really encourage folks to send that direct communication to members of the Finance Committee. You might not get an email back or a call back if it's not your legislator, but it's still worth doing. And then, of course, if you're an organization that serves, a community like ours that has many different representatives, always encourage you to reach out to them as well. And ask for the meeting, ask the direct questions, ask the hard questions. A lot of folks come in and share their perspective with us, and sometimes don't make the hard ask, right? And say, do you support this or do you not support this? And I think it's really great how sort of specific we got in this conversation. I support all the all the questions that you asked, all the proposals that you all support here. And, it's good for us to be pushed to answer that question directly. So just encourage you to keep doing that with all the legislators who are willing to meet with you.
What are the most effective ways to communicate with legislators today with all the different methods of communication available? Is it still a letter? Is it an email, phone call? Obviously, in-person meetings are always desirable, but there's limitations on that, obviously, during COVID or after COVID. But what are your thoughts on that today?
Yeah, I would, I think it's sort of in terms of the maybe ranking of communications, one would be ask for the meeting. see if you can get the meeting virtual or in person when that's safe, you know, with the legislator or with their staff. Most legislators will try and make that work, particularly if you're from their area. Then I would say you could call and you could say, is there a time when I can have a short phone conversation? Or do you have any office hours coming up, you know, that I could share my perspective? And then I would say I'm relatively agnostic between letter in the mail, email, and phone. Typically, I think letter in the mail would be best, but because of COVID, sometimes staff are not in the offices, you know, all the time. They're certainly getting their emails and checking the voicemail though. So I think all three of those are good options. Yeah.
Great, thank you. Any other questions? Representative Neubauer, do you have some closing remarks for us?
I'll just say again, I really appreciate all of your work. You know, there are a lot of challenges that we need to address in our state, and as we look towards our recovery from COVID-19, I think making sure that everyone, regardless of their income level, where they live in the state, their race, their gender, their immigration status, right, has access to mental health resources is critical. And the governor's budget has a lot in there, a lot of really important things. And we've seen bipartisan commitments to address this issue. And so I just appreciate that you all are doing what you can to hold us accountable to those commitments, to make sure that we're hearing directly from those who are impacted by these services or lack of services. And just encourage you to keep doing the great work, and appreciate you all being a partner in our community. Thank you.
And we thank you for your involvement and your willingness to participate in these types of forums and answer detailed, complex questions. And obviously you've given much thought to your positions on them. So we appreciate you sharing that with us and look forward to continuing the dialogue as we go forward. And I'll turn it back to Michelle at this point.
Well, thanks so much, everyone, for being here, for the opportunity to have such a great discussion. We have recorded this session and we'll make it available on our Facebook page as well as our YouTube channel within the next few days. So if there are no further questions, thanks again. Thank you, Representative Neubauer. Pat, thank you for facilitating. And we'll see you then. Thanks so much.
Thanks,
you all very much.
everyone.
Thank
Have a
you.
great evening.
You too.
Talk to you all
Thank you.
soon.